The menstrual cycle is the time between the first day of a period and the first day of the next period. A normal menstrual cycle is usually between 24 and 38 days long, but the length can vary from woman to woman. Here are some other things to know about the menstrual cycle. Phases. The menstrual cycle has two phases, the follicular phase and the luteal phase. The luteal phase is usually 14 days long, while the length of the follicular phase can vary from 10 to 16 days. Hormones. The body produces different hormones during the menstrual cycle to prepare for pregnancy. Changing hormone levels can cause menstrual symptoms. Bleeding. The typical amount of blood lost during menstruation is around 30 milliliters, and bleeding usually lasts 8 days or less. Bleeding that lasts longer than 8 days is considered prolonged. Menstrual symptoms. Some common symptoms include breast tenderness, bloating, mood swings, acne, cramping, and more hunger. Menstrual irregularity. Cycles that are shorter than 21 days are called polymenarcheic, and cycles that are longer than 35 days are called oligomenarcheic. Menarche and menopause. Menstrual cycles are usually most irregular around the beginning of a woman's reproductive life, menarche, and the end, menopause.